Hello, this is Neil Baum from New Orleans, Louisiana, and I'd like to use this opportunity to talk with you about the relationship between a full moon, the Super Bowl, and tax day, and its relationship to our modern day healthcare. The origins for this video came from listening to a podcast entitled Full Moon, Super Bowl, Tax Day, and Car Crashes. And I also point out that there may be a relationship between these three events and our care for our patients. A few facts. The United States has a reputation of some of the largest fatal car crashes per population than in other developed countries. Fatal car crashes rose 7% in 2020 compared to before the pandemic. This surprised me, as I thought with more people working from home, students attending school virtually, there would be less driving. However, car crashes, fatal ones, rose 7% in 2020. 9% of fatal car crashes in 2016 were related to distractions that cause these fatal car crashes. I'd like to summarize the work of Dr. Donald Rettelmeyer, a Canadian. He's a physician, and he was the first one in the late 1990s that studied the relationship between car crashes and the use of cellular telephones. He has studied car crashes, fatal car crashes, for the last 30 years. And he noticed that tax day was increased with the number of fatal car crashes by 6% compared to 1 week before April 15th and 1 week after April 15th. It's also noted in his study that the increase in death also applied to pedestrians who are involved in auto accidents. So the explanation that he gave was that stress for the deadlines, such as getting in the tax return, increased the fatal car crashes, both for drivers and for pedestrians. Next, let's look at Super Bowl. Super Bowl is associated with increase in car crashes after the Super Bowl game. There were decreased accidents during the 3 to 4 hours of the Super Bowl, as expected, because most of the population was looking at the game. And they noted that the increase in fatal car crashes was increased, especially if the team you were cheering for lost. And they gave as the explanation the stress associated and the excitement associated with the game, the increased consumption of alcohol, and distractions. Third, let's look at election day and fatal car crashes. And they compared car crashes one Tuesday before and one Tuesday after election day. And the study demonstrated increase in fatal car crashes on election day. Finally, there was a notice of, or an observation of increased fatal car crashes on the night of a full moon. And they compared the night of a full moon to a week before and a week after a full moon. And the explanation is that a full moon causes the driver to take his eyes off the road, even for just a split second. I want to tell you about my own experience. I was involved in a non-fatal car accident, and I believe the culprit was my attention to the radio. And when you look down away from the road, even for just a few seconds, to adjust the dial on the radio, you're taking your eyes off the road. Also pointing out that if you're listening to news, and certainly you don't have to search very far to find negative news, you can experience negative emotions that may impact your driving. So my take-home message regarding the full moon, tax day, Super Bowl, is that anything that takes the focus off of the road, even for a split second, increases the risk of an accident. And an accident on some occasions that can be fatal. So what's the relationship between fatal car crashes and healthcare? Let's start with the computer. The computer is considered one of the most significant distractions when a patient is in the exam room and the doctor is distracted by the computer. There is a drawing that appeared in JAMA by a pediatric patient who is shown in the middle, drawing her experience in the doctor's office with her mother holding a sibling and the doctor looking at his or her computer on the wall. There is a solution to the computer serving as a distraction, that is bringing a scribe into the room. And now there is a voice recognition software that can actually translate your voice into data so the doctor does not have to look at the computer and does not have to enter data into the computer. Another distraction is multitasking. I am guilty of this. I have a sign in my reception area in the exam room that says, please turn off your cell phone while in the office. And yet it doesn't, it's almost hypocritical if you ask the patient to turn off the cell phone, but the doctor is texting or looking at his or her cell phone during the doctor-patient encounter. And finally, there are interruptions where the staff knocks on the door and interrupts while the doctor is in the room with the patient. And I'll share with you a true story. I was with a new patient and I was interrupted 3 times while I was in the room with that patient. And returning after the 3rd interruption, the patient said to me, Dr. Baum, you do enjoy a very good reputation. However, I don't feel I have your undivided attention. Kindly provide me with a copy of my records, as I would like to see another physician. I felt terrible after this experience, and I made a promise to myself that I would only have interruptions while I was with the patient from the emergency room, the operating room, or the intensive care unit. Anybody else who called, including a physician, was told that I was with the patient, estimated the time that it would take for me to complete that encounter, and that I would return the call when I was between patients. I've never had a physician or a patient state that that was an unacceptable option to return the call between patients. So what's the bottom line? I had pointed out to you in the beginning that distractions can be fatal while driving a car. And distractions also can negatively impact the doctor-patient relationship. We have to look at those distractions that are affecting our communication with our patient and make every effort to avoid and eliminate them in our practices. Well, I hope you have found this video helpful and useful. If you would like a copy of the slide deck, I'd be happy to share it with you. And if you have any comments regarding distractions or how you manage them in your practice, please let me hear from you. I look forward to communicating with you again. Thank you.